Hey guys, it's Dr. Emer, West Hollywood, and I have one of my good friends, a fellow physician, that's here today because I'm the best, right?
You're the best.
Because he only trusts me with his face. No, we want to go. You gotta go to people you trust, especially when you're doing fillers and anti-aging or rejuvenation treatments. We're gonna be doing a little bit of fillers. We're gonna be doing laser. This is gonna be his at least treatment because I'm telling him he needs to take care of his skin. He's a good-looking young guy. We need to treat his skin and make sure he doesn't age. So by using fillers, we're gonna do some shaping. Big areas for him that he notices is his folds, under eye area, and temple. In that area, we call this the OG curve. We want to make sure that these areas stay volumized and lifted. The biggest thing that I notice, especially in LA, because we have a lot of people that get these treatments done, is that people overdo fillers to lift the skin. You cannot use volume to lift, and that's one of the things I try and teach people is that we're going to use volume here to subtly elevate, but if you over plump the area, you look unnatural. And creating symmetry isn't always more natural. So we're going to use volume for him because he's young enough to do a subtle lifting. But true volumization will not lift. And if you need lifting, you're going to have surgery, or you're going to have to do skin tightening treatments, etc., threads to help lift the skin at the same time that we do volume. So we've already actually done one of the temples here. Turn a little bit this way. He's not that hollow, but by volumizing here, look what happens to the lateral eye and cheek. And so by injecting a little bit of filler down onto the bone here, we can get a nice elevation of the tissue. And long term, you may not notice it as much now. He's just going to look healthier, more rested, rejuvenated, because this area has some volume.
So for everyone, I would definitely say there's a lot of injectors out there, and they're all really, really good. But there are very few who are really good with injecting on men and making you not look like a lady. So I mean, definitely pick your injector and find someone like Dr. Emer who specializes in men, who has a very good aesthetic, because you want to come out looking like a guy.
Right,
and that's a good thing.
Unless you don't want to. I have some patients who don't. But in general, we want to keep our men looking more masculine, so we call it masculinization versus feminization. And in some of my patients, I don't think they realize it, but they get feminized. And that's the thing, we don't want to do that. So we just did, how was that injection into the temple? Was it painful?
I didn't feel a thing.
Well, that's great. So the key is to understand your anatomy so you can go into the right planes when you're injecting. And even here is very minimal bleeding, and we're using needles. So again, he already has a nice cheek smile. He already has fullness, relax. We just want to place it strategically in areas where we're going to get a little bit of lifting. And remember I said small volumes are fine for lifting, but large volumes are not. We're using here Restylane Define because I like this because he's a very happy, smiley person. And this is one of what we call the more flexible mobile fillers. It's likened to honey because it literally molds into the skin. It gets sticky within the skin. It's not going to lump or bump if you inject this properly. Now, one of the things that I want to point out, this isn't to point out anything strategic, but as we age, this area specifically and this area specifically start to lose volume. So it's really important, and this is a telltale sign that people who get fillers are getting proper fillers, is when they don't volumize those areas. Smile again. Great, relax. We got to keep them very masculine looking, because that's our goal. Perfect. And so what we're going to do, we just did a little bit of mid-face lifting, and now we're going to go to his under eye and the lateral eye. Those two areas we're going to use a different filler, because I like something a little softer in men that lasts longer, because most men metabolize fillers very quickly. So Vicross technology made by Juvederm, turn a little bit this way, will last a little bit longer. So for example, this area here where there's just a little bit of volume loss, you can use a cannula, or we can go in with a very small 32 gauge horsehair needle and inject a little bit of filler here to this lateral eye area. You can see already, look, filling up. It's a nice soft filler for this area. It's great for men. But what's important about Vicross is you only use small amounts of the filler at a time. As long as you use small amounts, you're going to get a great result. If you overdo it, there's a chance for inflammatory reactions long term. So small amounts, little depot injections, and he's doing really well. He doesn't need that much, but the reason I'm using the needle is we're going to laser him anyways, so it won't matter if he gets bruised or swollen, which he's not going to really, honestly. Because we're using such a small needle.
You can stab me. I don't feel anything.
You're doing great. I thought you said you were so sensitive.
Well,
And we don't stab, we pinch. We don't stab in this office, we pinch. So now we're gonna go to the other side. Did they say anything on Instagram? Oh, it's great. So again, this lateral corner, you see the orbit here as we age, you lose volume, the eyes become set back. So what we wanna do is we wanna keep this area volumized, just small amounts. And look, if somebody's smiling when they're getting fillers, you know that you're in a good place. So this is great. Small bits, again, very subtle. We're using a little baby needle. Could use a cannula, but I just want to fine tune. This side needs a little more volume around the eye. And the other side, smell. Every so often people have a tendon that is a little more superficial that connects from the nose to the cheek. And when they smile again. Right now you can't see, but there's usually a little line right here, so you can use some fillers to soften all that. So this is a nice soft look. We could potentially go and add a little more to these areas and to the folds, but this is a good starting point. Let me at least show him. So go and let him see. Take a look. Smile. So you see how when you smile, you have to have a ridge here. It's important. Mm-hmm. You have to have your eyes. If you don't have, if it blends right into your eye, you've lost your actual anatomy. Temple's perfect. It's filled out. Then the only other question to you is, do you care enough to want a little bit more here or here?
What do you recommend?
Well, it's up to you. I mean, I personally, you live far away, so to me, I would say probably do it because you're here. I would add a little bit more here and just a subtle here.
The first time I had filler in the infraorbital, the surgeon was very conservative, and it was not nearly as pleasurable as experience as this.
Oh, really?
I would just say go aggressive.
Might as well do a little bit more.
Go aggressive.
So we'll at least stop there so you guys can see that almost no bleeding or bruising, even with needle pokes. He's super happy. He didn't have a bad experience. It wasn't tormenting. So we're going to add a little bit more to fine tune it, but you guys can see there it's a great result already. He doesn't look any different. He just looks more rested. He's happy. That's the important thing. All right? So that's male facial sculpting with fillers in the periorbital area and the midface. All right, so let's do